When I introduce this concept to people, people often ask me, well, do I have to be perfect? Do I need to be 100% perfect all of the time? And, you know, I've learned different things over the years of what's worked and what hasn't worked. The optimal diet for cardiac patients, I think the science is clear that a no added oil, whole food, plant-based diet, an Esselstyn diet, is the optimal diet to both stabilize and even reverse coronary artery disease. I think there's no question about that. So in that sense, strictly speaking, very mechanically, is the best approach 100% compliance with this diet? It is. But I'm dealing with human beings. If it's all overwhelming first, and even if people have established coronary disease and are very sick, if I can convince them to try 2 or 3 healthy meals a week and see if they can build up their confidence in trying to focus on 2 or 3 healthy meals a week and find some of those plant-based meals, say from the Forks Over Knives website and the recipe bank there. Get them to just introduce some of these meals and convince themselves that some of these plant-based recipes are tasty, they're hearty, they fill the patient up, and they're easy to prepare. Then I find if you can get them a third of the way there, halfway there, and keep doing that for 4 to 6 weeks, they'll start feeling better the days that they're eating well. They'll feel poorly the days that they're not, and they'll start noticing that, and that then can be a powerful motivator to help increase the percentage of times that they're compliant with plant-based nutrition. And then where that ends, I think, is dependent on the patient. Some patients they feel so improved that they're tremendously motivated then to make the next step and maybe go 70, 80, 90% plant-based or more. Other patients, maybe psychologically, all they can manage is 50 to 70% there. But again, I keep reminding them, you know, don't be so harsh on yourselves. If you're not eating plant-based perfectly, or you slip off and eat animal-based foods or go to treats or processed foods, just keep in mind, keep a diary. Look back, compared to 3 months ago, 6 months ago, you've come a long way. And sometimes it takes that baby steps and little celebrations of tiny little accomplishments in order to encourage people to be kind to themselves. And then a year later, sometimes it's extraordinary the gains that people have made. So I don't see there to be a standard one-size-fits-all approach for this, because we all judge ourselves in different ways, and some of us, again, are very harsh. And when we slip up, you know, there's a zero tolerance for slipping up, so then people can get overwhelmed. So I think it needs to be tailored to the person's own value system and how harsh they are on themselves. Sometimes I sort of act like the referee between, you know, their harsh self and their practical self, and just offer encouragement and support for the first few months until they get some recipes down into a routine. And then as they pay closer attention to how the meals affect how they feel and start being observant to that, then they act as their own motivator once they notice that difference.